Thanks.
Thank you, Senator Young. Senator Carper.
Thanks, Mr. Chairman. Welcome, everybody. Nice to see you. Thank you for joining us for this important conversation. I think all of us agree that home-based health care plays an essential role in ensuring that everyone receives the care that they need, when they need it, and where they want it. We saw the demand for home-based health care rise during the COVID-19 pandemic. Hospitals and healthcare facilities were over capacity, as we'll all recall. Patients preferred to receive care at home where possible and when appropriate. One program that was established to meet this demand was the Acute Hospital Care at Home Waiver Program, known as Hospital at Home, because it allows Medicare beneficiaries to receive hospital-level health care services in their home. Since its enactment, hospitals and health systems across, I think 34, my last time I checked was 34 states, including my own home state of Delaware, have utilized the Hospital at Home program to provide safe, high-quality, hospital-level services in the homes of patients. The Hospital at Home program has been a true success story. It has delivered positive outcomes. It has delivered a higher reported patient satisfaction, and I understand it has also delivered potential cost savings. Where I come from, that's a win-win-win situation. And to ensure that patients and their providers would have access to the Hospital at Home program for 2 years beyond the duration of the COVID-19 public health emergency. Last Congress, Senator Tim Scott, a member of this committee, and I introduced the Hospital and Patient Service Modernization Act. I am proud that the Congress passed our bipartisan bill, and it was signed into law by President Biden last year. A question initially for Mr. Dombey, and I think for Dr. Grabowski. Same question of each of you. Mr. Dombey, could you please share how the Hospital at Home program has continued to serve patients past the end of the public health emergency?
Well, I'll call it the demonstration program of enlightenment.
I like that.
And I thought of it just moments ago, but
you mind if I steal it?
It's all yours. What I mean by that is, we built the Medicare program in 1965 on a continuum of care concept that was setting focused. And the Hospital at Home demonstration program shows that the continuum of care should be patient-focused rather than setting-focused. The capability of delivering a high level of acuity of care to individuals in their own home, bringing high-quality results, cost savings, and certainly a lot of satisfaction. None of us wants to go out of our home for health care if there's a way of avoiding it. So more than anything else, put aside the technical aspects of the program and the like, it's just that this has created an environment for innovation in the delivery of healthcare that's even wider than the Hospital at Home program. And that's what I'd love to be able to have conversations with this committee about instead of payment rates for a program that actually established that care in the home is cost-effective, high quality, the home health benefit under the Medicare program. So I'm hoping for, before I'm needing Hospital at Home services, to be able to have those kinds of conversations.
All right, good. Thank you. Dr. Grabowski, same question. Could you share with us how the Hospital at Home program has continued to serve patients past the end of the emergency?
Yeah, it's an incredibly innovative program. We have a model in Boston, just down the street from where I work at Brigham and Women's Hospital. Some colleagues there have a Hospital at Home program, and when they actually put it out in the field to test it, they actually had to self-finance it because there was no payment mechanism to support Hospital at Home for patients in the Boston market at that time. This is a place where I think a lot of the delivery level innovations are maybe ahead of some of the payment innovations that are out there. So I'm also, similar to Mr. Dombey, very excited about this kind of model and its potential.
Good, thank you. A follow-up question and for each of you, for Mr. Dombey and from Dr. Grabowski. What lessons have we learned from the success of the hospital at home program. What should we as legislators keep in mind as we look toward making hospital at home a permanent program?
I mean, we learned, among other things, the marriage between professional services and technology actually enhances the quality of care. We've learned that we should not hold ourselves back from creativity and innovation and live in the 1965 era of the Medicare program. We should learn also to listen to the providers of healthcare services. It was at Johns Hopkins that hospital at home was born as a concept many years ago. But it took quite a while to take off for that. So I think we've learned a lot, that could be there. And we've learned a lot still as it's unfolding on how we can refine it, improve it, and really make it, the full value that's out there, including how it can be a transition to segue back to the Medicare home health benefit, a segue back to home health services when an individual's level of care needs are satisfied from the hospital level back to the home health side.
All right. Thank you for that. Same question, Dr. Grabowski. What should we as legislators keep in mind as we look at possibly making hospital at home a permanent program?
Sure. The title of this hearing is Aging in Place, and I think sometimes we have a very narrow view of aging in place. The hospital at home program suggests we should not limit ourselves to very particular models, but think quite broadly, because there's incredibly innovative models that are out there. This hospital at home really, I think, is pushing the envelope, and I hope that policy catches up with kind of some of what's happening at Hopkins and also at Harvard. Mr. Dombey called out Hopkins, but also they may have started at Hopkins. Lots of great.
He was
work
right to call out Hopkins. That was the
Are we dealing with a rivalry here?
All right. Our thanks to all of you. Thanks for joining us today. It's a good discussion. We appreciate it very much.
Senator Hassan.
Thank you, Chair Cardin, and I want to thank you and Ranking Member